Here we have in our newsroom is Dr. Cole Beeler from IU Health. Dr. Beeler, great to see you.
Yeah, nice to see you again.
Okay, so we are talking about the CDC had just made a recommendation, well, not a recommendation, that people need, before they board a flight, need to test negative for the coronavirus. And this comes after four passengers boarded a flight, or people boarded a flight, and four passengers in flight, an 18-hour flight from Dubai, seem to have gotten the virus in transit. So, I mean, first question is, how is this possible that they could have contracted the virus on board?
Yeah, I mean, I think that what it seems like on this report is that there was one infected person that got on the plane. Even though they had a negative tests aren't perfect. They tell you if you might be infectious at one point in time. They don't give you information about what's actually happening to you when you're actually on the plane as far as infectivity. So I think that one infected person was able to actually infect the other people around them. And it was following a lot of the same patterns that we're used to seeing, which is the people who are closest to the infected person had a higher probability of getting infected.
Mm-hmm. And what does this say about the environment of a plane? I mean, I read somewhere that planes actually have good ventilation, air ventilation.
Yeah, I mean, international air travel, I think, is problematic for COVID in general. I don't necessarily associate it with the plane as much as I do maybe the airports and just being around clusters of people. But even the plane, which puts you in close proximity to a lot of people who may or may not be masking, depending on what type of flight you're on, is problematic and does potentially put you at risk for contracting COVID.
Mm-hmm. And going back to what you said about the person having the coronavirus, perhaps they had a false negative. We know that very early in time, the virus is not, there's not as much there. So that's why we have these false negatives. So how is this CDC guideline or this CDC saying this, that they need to get tested beforehand, when it just could have been, well, we don't know yet that you have the coronavirus, when you very much could have it?
Yeah, I think this case highlights that even with the best protocols, there's still going to be bleed over. There's still going to be transmissions that happen because, unfortunately, with this virus, you shed and are infectious when you're not symptomatic, and our diagnostics actually don't work as well. Except around the times either right before you're symptomatic or right after you're symptomatic. And the sensitivity of our tests any other time might not be optimal to making sure that we're able to 100% exclude that someone may or may not be infected. Now, I would say that any sort of policy around testing is better than a policy of not testing. So it is a step, I think, in the right direction around these prolonged flights where people are at risk, but there's still going to be cases that this flight highlights where there's transmission that occurs despite best intentions.
And our testing really hasn't gotten much better from the beginning. And I'm just wondering what your thoughts are about that.
Yeah, I mean, I think we have probably the best technology that there is to really diagnose any sort of microbial infection, which is PCR, that's available for detecting this, which is usually very sensitive. Unfortunately, the way that this virus interacts with the human body is that it can ramp up its productivity, its production of virus very quickly. And it can also decrease it very quickly. In addition to that, there are a lot of different types of tests for coronavirus, and some are better than others. So some people might get actually a less good test, like what I would consider to be an antigen test. It's just not as reliable. It's not as sensitive. And that might provide some false reassurance when you get on the plane that you aren't infectious. So there's a lot that goes into it, not just the interaction between the virus and the human, but also the type of test that's being run, what the cutoffs are that you're using, et cetera.
If we are looking at planes right now, do you think this will lead to other types of transportation, trains, other buses, public transportation? Is that something that we can see, or you would anticipate seeing moving forward?
Yeah, I would consider them really all the same. You're clustered together in close seating arrangements with maybe questionable ventilation. I would say the main difference between most bus and most train rides is that they're quicker in general, but for longer bus rides and longer train rides, I think that that's a higher risk. In general, you get infected with coronavirus as a function of time proximity and density of the virus that's around you. So the longer that you're closer to someone that has coronavirus with poorer ventilation or less kind of clearance of the virus that's in the air, the higher probability that you're going to be infected. So that spreads to all sorts of corollary situations that aren't just necessarily travel related, but also tightly packed restaurants, bars, gyms, places that people maybe aren't able to de-densify or avoid as much. And the longer you're in those settings, the higher risk that you might get the infection if someone there's also infected.
Mm-hmm. And would you recommend sticking to necessary travel only? I know that was a big thing early on when we had the coronavirus. What are your thoughts?
Yeah, I don't think that we're in a setting right now across the world, especially in Indiana and the United States, where any sort of optional travel over airlines makes a whole lot of sense to me. If it's something that you elect to do, it's putting you at risk, and it's potentially putting the people around you at risk because you don't know who you're going to spread it to. So I honestly think it's kind of a bad idea right now, just because the virus is everywhere. It's spreading very silently. But people are still getting very sick and dying from it. So we have to just maintain and caution when doing any sort of activities that are outside of our normal sphere of practice.
Mm-hmm. Scientists are saying that they are looking into researching this more. What would that look like?
Yeah, I mean, I think there's a ton of questions that need to be asked related to how viruses, or COVID in particular, spreads in these close quarters of airplanes. We still don't know a whole lot, and each individual is a little bit different as it relates to when the virus decides to shed after infection, how long infectivity goes on, what the infectious dose is of the virus. So how many individual viruses do you need to get into your lungs before it can set up shop and maintain an infection? All of this stuff would be helpful to understand kind of how to mitigate risk to a certain extent. But unfortunately, COVID has created a lot of speed bumps along the way with trying to help us understand exactly how we can build rules around protecting every single individual. It tends to break a lot of the rules.
Mm-hmm. Last 30 seconds, what would you like to add?
I mean, from my perspective, I think the big thing is just being very cautious with any sort of extra activities that you're thinking about doing right now. COVID is getting worse in Indiana. It is still a very serious infection, and we are a long way off to getting enough of the population vaccinated in time to actually make a dent in this. So we're in for a few rough months again here. So avoiding travel, avoiding interactions with large groups of people continues to be prudent.
Mm-hmm. Dr. Bueller, thank you so much for your time and your insight. Really appreciate it.
Sure. Yep. My pleasure.